Hey everyone, and welcome to The Explainer. I am so thrilled to have you here today. We are going to dive right into some incredible material. Today, we're taking a wealth of clinical concepts, everything from grief and loss to cultural humility and accessibility, and we're bringing them completely to life. Instead of just, talking about high-level theory, we're going to do a highly practical, chronological walkthrough of clinical skills using a real case integration. By looking at exactly how a counselor applies these techniques in the room, we can build a deeply effective, real-world toolkit for counseling people with disabilities. So here is our clinical roadmap for today. We'll start by meeting our client, Jose, move into accessibility prep, then walk through core skills, cultural humility, solution approaches, and finally, wrap up with ethics and autonomy. Let's get into it.
All right, part 1, meeting Jose. The absolute foundation of this case integration is seeing the client as a whole person experiencing life transitions, rather than just staring at a diagnosis on a chart.
Let's ground ourselves in Jose's reality. He's a 21-year-old Hispanic male with a mild intellectual disability, specifically Down syndrome. He is a recent high school grad who is still living with his parents. And like literally so many 21-year-olds, his goals are super clear. He wants greater independence, he's looking for employment, and he wants a bigger social life. We need to immediately establish him as a young adult navigating a major, universal life transition.
But here's where the clinical picture gets a bit complex. On one hand, Jose has this genuine, amazing excitement for adulthood and independence. But on the other hand, he's actively grieving the loss of his familiar childhood routines and security. He's experiencing real anxiety and self-doubt, terrified he might disappoint others or just not be good enough to succeed. As counselors, recognizing this duality is absolutely crucial. This uncertainty about his future isn't just standard jitters, it requires a grief-informed practice to truly support him. Moving on to part 2, accessibility before the session. Because, let's be real, excellent clinical work actually starts well before the client even walks through your door. Look, we've all been there, right? You're 5 minutes into a session and suddenly realize the chair's in the completely wrong spot. If we want to create a genuinely inclusive environment, we have to be proactive. Step 1, ensure physical space accessibility. Step 2, commit to using clear, concrete language. And Step 3, provide additional processing time. Without these logistics handled ahead of time, the real therapeutic work simply can't happen.
Okay, so the session begins. Imagine opening the dialogue with something like this. Jose, I want this to be a space where you feel comfortable sharing your thoughts and experiences. If I ever say something confusing, please let me know, and we can slow down or explain it differently together.
Why is that specific phrasing such a game changer? Well, establishing safety right out of the gate supports accessibility and respect, for sure. But even more importantly, it directly reduces the inherent power imbalance in the room. By explicitly inviting feedback, you're making it safe for Jose to advocate for his own communication needs right from minute 1. All right, Section 3, Core Therapeutic Skills. Let's look at active listening and validation in real time. Picture Jose sitting across from you, and he says this. Everyone keeps asking what I'm going to do next. I know I should be excited, but honestly, I feel scared. You can just hear the overwhelming pressure of those expectations, right? He is terrified of stepping into adulthood and failing. And here is how you might respond. A part of you wants to move forward into adulthood, but another part feels nervous and overwhelmed by all the changes happening. Notice what we didn't do here? We didn't rush in to say, oh, don't worry, you're going to do great. Instead, we provided a warm, validating response that holds space for his emotional distress without instantly trying to minimize it. That right there brilliantly illustrates the technique we call reflection of feeling. It means reflecting those underlying emotions so the client feels deeply understood, rather than just immediately throwing advice or reassurance at them. By doing this, we help Jose explore his experience safely. We make him feel truly seen. Which brings us to Section 4, Cultural Humility in Practice. This is absolutely critical, especially when we're navigating complex family dynamics. So, say Jose mentions that his parents worry about him all the time, and he's frustrated because he's not sure they see what he's capable of. Instead of making assumptions, or worse, criticizing his family's approach, you ask this wonderfully open-ended question. What does becoming independent mean to you and your family? Guys, this is cultural humility in action. It recognizes that family expectations and cultural values uniquely shape how a client experiences adulthood. Independence doesn't look the exact same for every single client or every family system.
By staying curious, you avoid projecting your own cultural definitions of independence onto Jose.
Next up, Section 5, Motivational and Solution-Focused Approaches. Once we understand his context and validate his fears, how do we actually help him build self-efficacy? Jose says he wants a job, but he's scared he'll mess the whole thing up. You validate that ambivalence, and then you use this incredible prompt. Can you think of a time when you felt proud of yourself or successful doing something independently? This exact question shifts the entire dynamic. It pivots him away from the fear of failure and prompts him to remember past successes, like say how confident he felt when he volunteered at the local animal shelter. By asking those targeted questions about his time at the shelter, we're utilizing solution-focused brief therapy. This approach helps the client identify their own strengths, their coping abilities, what supportive environments actually look like for them, and their existing resilience. We are literally helping him uncover the tools he already has in his back pocket. But, and this is a big but, while we're using these high-level frameworks, continuous conversational accessibility remains a non-negotiable priority. Keep these steps in mind. Step 1, pause more often. Step 2, consistently check for understanding and summarize key ideas. And Step 3, use visual supports. For instance, you might say, hey, would it help if we wrote down some of the strengths you identified today so you can review them later? That tiny adaptation, it promotes massive inclusion. All right, our final section, ethics, autonomy, and respecting boundaries.
I really want to draw a hard line in the sand here. On one side, we have paternalistic assumptions, assuming the client can't make decisions or speaking primarily to their caregivers instead of them. No way. On the other side, we have true ethical practice. If Jose's parents request detailed updates, ethical practice means discussing confidentiality and consent directly with Jose to empower his active participation. It means supporting his autonomy and respecting his dignity at every single step.
When we pull the whole shebang together, we see that technical skills alone just don't cut it. A comprehensive counseling toolkit requires empathy, accessibility, cultural humility, ethical awareness, flexibility, and above all, a genuine willingness to truly listen. That is how we ensure clients feel seen, valued, and emotionally safe. I want to leave you with this core thesis derived straight from the source material. People with disabilities experience grief, identity transitions, fear, resilience, and hope just like anyone else. Because of that, disability should never, ever reduce our expectations for meaningful emotional experiences, personal growth, or deep human connection. And that wraps up our explainer for today. But before you go, I have a final provocative question for you. Knowing what we've covered today about accessibility, validation, and autonomy, how will you adapt your clinical practice to ensure clients with disabilities are empowered to navigate their own emotional complexity? Thank you so much for joining me to explore this vital topic. Keep learning, keep adapting, and I'll catch you next time.